Good morning, students. We will see some of the MCQs, that is, means not the multiple choice questions actually, it is some of the questions and answers in the anatomy and physiology about the OBG nursing. The normal female pelvis is, it is gynecoid. Normal male pelvis is, it is android pelvis. The other name for anteroposterior diameter of the pelvic brim is the true or anatomical conjugate. The obstetrical conjugate is 10 centimeter. The bispinous diameter is 10.5 centimeter. The wide gap in the suture line of the fetal skull is known as frenulum. Total number of frenula in the fetal skull is 6. The anterior frenula, otherwise called as brecma. Lambda is the posterior frenula. Brecma is formed by three sutures, which is coronal, sagittal and frontal sutures. The shape of brecma is diamond in shape. Brecma is that centimeter in length and that centimeter in the width. It is 4 centimeter in length and 2.5 centimeter in width. Anterior frenula fuses at that years of age. It is almost occur at 1.5 years of age. Lambda is in triangular shape. Lambda fuses at around 6 weeks. Lambda is formed by sagittal and lambdoid sutures. Change in the shape of the fetal skull because of the constant pressure of fetal pressure of the fetal skull on the pelvis is termed as molding. The female organ homologous to male scrotum is the labia majora. Female organ which is homologous to male penis, it is the clitoris. The lower portion of labia minora uses across the midline to form a fold of skin which is known as fourchette. The gland situated in the superficial perineal pouch is called as Bartholin's gland. The fibromuscular membrane sheath communicating uterine cavity with vulva is vagina. The diameter of vagina 2.5 centimeter. The length of clitoris is 2.5 centimeter. Vagina is lined by stratified squamous epithelium. The length of anterior vaginal wall is that centimeter and posterior vaginal wall is that centimeter. Anterior vaginal wall is 7 centimeter and posterior vaginal wall is 9 centimeter. The activity of vaginal secretion is due to the presence of dash which produce lactic acid from glycogen. It is the Doderlin bacilli which produce lactic acid from glycogen. So the acidic activity of vaginal secretion. pH of vaginal secretion is 4 to 5. The shape of cervix is cylindrical. The length of uterine cavity is 3 inches, that almost comes at 7.6 centimeter. The length of isthmus is 0.5 centimeter. Length of cervix is 4 to 5 centimeter. Average length is 3.5 centimeter. The cervical secretion is dash in nature, is alkaline in nature. The fallopian tube is otherwise called as uterine tube or oviduct. The ovaries length, breadth and width. Ovaries 3 cm in length, 2 cm in breadth and 1 cm in width. Most important muscles supporting the pelvic organs are called levator ani muscles. The muscular partition which separates pelvic cavity from anatomical perineum is called as pelvic floor. The obstetrical perineum is of that shape. It is pyramidal in shape. Female urethra's length and diameter. It is 4 cm in length and 6 mm in diameter. Capacity of bladder is 400 ml. The bladder can retain 3 to 4 liters of urine. The shape of a distended bladder is ovoid in shape. Process of maturation of two highly specialized cells, spermatozoa in male and ovum in female, before they unite to form zygote is known as gametogenesis. The process involved in the development of mature ovum is called as oogenesis. The outer transparent mucoprotein envelope of ovum is called as zona pellucida. The process involved in the formation of spermatids from primordial male germ cells and their differentiation into spermatozoa is called as spermatogenesis. The time required for spermatogonium to mature spermatozoa is 61 days. The process whereby the secondary oocyte is released from the ovary following the rupture of mature graphene follicle and become available for conception is called as ovulation. The process of fusion of spermatozoa with mature ovum is called as fertilization. The fertilization occurs in that part of fallopian tube, the ampulla of the fallopian tube. The fertilization lifespan of oocyte is almost 12 to 24 hours. The fertilization lifespan of the sperm is nearly 48 to 72 hours. Chemical present in the sperm which is necessary for penetration into ovum is called as hyaluronidase. The implantation occurs that day of fertilization or that day of regular menstrual cycle. This occurs almost on 6th day of fertilization or it corresponds to 20th day of a regular menstrual cycle. Thank you for listening. If you have any comments, please let me know.